Hello, everyone, and welcome to the AMR Narrative YouTube channel, dedicated to bringing diverse voices together to improve the understanding of antimicrobial resistance. But that's a bit of a tongue twister, so we also like to use the term AMR. My name is Vanessa Carter, and I'm an AMR patient survivor who fought bacterial-resistant infections for many years. And one of the challenges I faced was not understanding AMR. In fact, I hadn't even heard of it before. This YouTube channel has been created for other patients and people who want to learn the basics. So in this episode, from a patient perspective, I interviewed Dr. Ron Daniels, Chief Executive of the UK Sepsis Trust. He not only explains what sepsis is and how to identify it as a patient, describing the role of different diagnostic and testing methods, but he also answers my questions about how AMR in some cases could play a role in sepsis. So let's get started.
My name's Dr. Ron Daniels. So by background, I'm an intensive care doctor working out of Birmingham in the UK. I founded the charity, the UK Sepsis Trust, back in 2012, and I continue to run it jointly with my joint chief executive, Sarah Hamilton Fairley. I have another role, which is as vice president of the Global Sepsis Alliance. The UK Sepsis Trust is a registered charity across England, Wales, and Scotland, and it fulfills three main functions. First, and really most important, we support people affected by sepsis. Now, that will of course include people who've survived sepsis, but it also includes those who've been bereaved by sepsis, as well as people who are caring for survivors. So three really important functions within that work stream. The second is providing health professionals with the knowledge and tools with which to spot sepsis quickly and act quickly. And one great example of that is our Sepsis 6 care pathway, which is a 1-hour treatment pathway that can be delivered by any health professional, however junior. And that's in use in 40 countries around the world. And then the third work stream is raising public awareness. It's critically important, with sepsis being such a common condition and being time critical, that our public know when to seek help from healthcare. So we deliver awareness, we deliver symptoms awareness, and we empower people to access healthcare quickly. So those are the three things that our small charity does.
Great, thank you so much. I think one of the most important things you said was, patients sort of being aware of something that sounds like it is a common thing, right? But it's something that I'd never heard of before. Myself as a patient. So out of interest, what is sepsis and how is it caused?
So sepsis is the way the body responds to infection. So the definition, it's a life-threatening condition arising when the body's response to an infection causes organ damage. And it can be triggered by any infection. Most commonly, in high-income countries, it's pneumonia, urinary tract infection. These things are common: cuts, bites, stings, and then problems in the abdomen. In high-income countries, those four sources of infection give rise to 95% of episodes of sepsis. And you said, Vanessa, that this is common. I think people listening might not understand quite how common it is. It's estimated that sepsis affects 49 million people around the world every year, claiming 11 million lives, with almost half of those lives being children in resource-poor countries. Sepsis claims more lives around the world than cancer. And in a high-income country, sepsis is as common as heart attacks. So this is an incredibly prevalent condition.
Yeah, so it's somebody that myself, who suffered a lot of infections, really serious infections. What are the symptoms of sepsis, and when should a patient like me seek medical assistance?
So the first thing to say is you've got to trust your instincts, and almost all of us know what having an infection feels like. And if we have an infection or symptoms of infection and something really doesn't feel right, so it might be that you've never felt this unwell before, or it might be that you're deteriorating when you'd expect to be getting better. If those things are happening, it's important you seek help. And that would usually be through a community-based doctor, like a general practitioner in my country, or services where we can seek online help. However, if you're really worried, if you think something very bad is about to happen, There are 6 key symptoms to look for, and these are applicable whichever country you're in. S for slurred speech or confusion. E for extreme pain in the muscles or joints. P for passing no urine, no water in a day. S for severe breathlessness. I for it feels like I'm going to die, and people really do say that. And the final S for skin that's mottled, discoloured, or very pale. That symptoms list, it spells the word sepsis. It was developed by the UK Sepsis Trust and adopted by the Global Sepsis Alliance. And any one of those 6 in the context of an infection, it's get yourself straight to hospital. Not tomorrow, not this evening, but now.
Yeah, and you know what? I think that really, really helps patients like us because it's nice and simple to remember, especially for such an urgent, condition. So how, I mean, when we have sepsis, when we think we have sepsis, how is it diagnosed and treated?
So we diagnose sepsis, it's a clinical diagnosis. So the bad news is there's no single blood test. There's not one examination of a patient that will say this is sepsis. This is about a collection of things. So we take a history from the patient and examine them, and that might give us a clue about where the infection is. An example might be someone who's had a cough for a couple of weeks, they're coughing up green phlegm, they began to feel feverish and now they feel worse. We would suspect a pneumonia. To diagnose sepsis, the way the body responds to infection, we have to look for organ damage. Now, there's an official way of doing that, which is called a change in the SOFA score or sequential organ failure assessment score. But frankly, that's very complex and it can be very difficult, if not impossible, to measure that in a busy emergency department. So most countries have adopted some pragmatic approaches to this. In the UK, we use our National Early Warning Score as the trigger point to start a screen for sepsis. So again, unfortunately, we don't have a single blood test. There are lots of blood tests we send that help us to identify what's going on, but this is about a clinician building a picture. And that's why it's so important our public are aware. This is not easy for clinicians to diagnose. So we have to have a public who are able to just ask, could it be sepsis? And health professionals who are trained and who think sepsis.
Yeah, that's really important. And I guess it goes back to, the sepsis, identifying all the symptoms that come with that. I think that, working as a patient in antimicrobial resistance, this has always been quite a big question for me. Again, being a patient with MRSA that could have got a bloodstream infection and sepsis. So, I mean, can you explain to me what are the links between sepsis and AMR?
Well, these two things are intrinsically interrelated, so much so that we launched the Infection Management Coalition last year, and it really calls upon governments to think about sepsis and AMR and infection prevention in one policy space. They are part of the same problem. Now, AMR is out there, and it's not a future threat, as you know, to your cost, Vanessa. It is here today. There are patients that I have in my ITU right now who have resistant bugs, and we have to change the antibiotics accordingly. So it's a problem today. Now, in terms of describing how sepsis and AMR are interrelated, there's really a few aspects to this. As I've said, AMR is here right now. And one quite scary stat is a lot of UTIs are caused by a bug called E. coli. And even in high-income countries with relatively good antimicrobial stewardship like the UK, we've got 10 or 15% of those bugs are resistant to our first-line antibiotics. Now, what does that mean? It means the infection is undertreated at outset or untreated at outset. And it's more likely that sepsis will develop. And of course, as AMR grows as a threat, we're going to see more and more simple infections that are undertreated and more people being likely to go on and develop sepsis. The second way they're related is, of course, sepsis itself might be difficult to treat. The patient might not know that they've needed antibiotics in the community and they present when they already have sepsis. Now, the way we clinicians address this is we give our best guess antibiotic at the outset. We look for where the source is, we think about the right antibiotic. But if it's a resistant bug and we get it wrong and we're not treating it, that person's sepsis is going to get worse. And the final way really in which they're interrelated is that AMR in itself doesn't kill people. AMR is about bugs that survive antibiotics. And to say that AMR is a cause of death is to me as foolish as saying somebody died because their chemotherapy didn't work. It's the infection that we can't treat that claims the lives of people whose bugs demonstrate AMR. And I think we've got to get our language around this a lot better so that people understand not only that AMR is here today rather than being a perceived future threat, but what we're really talking about here is infections we can't treat. And if we can't treat them, as I've said, that will give rise to a lot of people with sepsis.
Yeah, so I guess it kind of starts at the ground level, really before it develops into sepsis is one of the things that you said, and of course, not knowing the antibiotics at the time to treat with. But that's really frightening because myself as a patient, we didn't know what antibiotics we had to be using. The infection just kept on developing, and so that makes sense to me. As you say, it becomes something that goes into your bloodstream, becomes something worse, becomes sepsis, and you just can't treat it anymore. So what do you think can be done to reduce the risk of AMR, and why do you think it's important?
So I think there are some very high level things, of course, that need to be done around AMR. And one is improving the pipeline of antimicrobials and sort of non-antibiotic compounds that have effectiveness against bacteria. So this is really important. Obviously, it's not just about bacteria, but let's focus on bacteria for now. So we've got to improve that pipeline. There's not a lot of incentive for pharmaceutical companies to develop new antibiotics because, frankly, antibiotics are cheap and we don't have the whole population on them at any one time like we do a statin. So we've got to encourage governments and grant-making organizations to incentivize this. And NICE here in the UK at the moment are looking at pilots for 2 novel antibiotics to reward the drug company based upon the value to society of that antibiotic rather than the individual cost per tablet or per dose. So incentives like that are really important. But the average person in the street is not going to be able to directly impact on antimicrobial pipelines. So what can the rest of us do? Well, of course, we health professionals, but also the public we serve, need to adopt a more responsible approach to antimicrobial consumption. Gone are the days when we think it's okay that we've had a cough for a couple of weeks and we're going on holiday and we want to feel better, so we go and get some antibiotics just in case. That practice should not happen. We've got to understand, the public need to understand, antibiotics are only there to treat bacterial infection. And they won't be effective for a cough or a cold or the flu or COVID-19 should it rear its ugly head again. So we've got to act responsibly. The public need to not seek antibiotics too readily, and health professionals need to not prescribe them too readily. But we also have to remember that only about 50% of antibiotic use in the world is in humans. 50% or thereabouts is used in agriculture. And yes, intensive farming often gets blamed here, but it's not just around intensive farming. The routine use of antibiotics in agriculture, particularly intensive agriculture, needs to be controlled. And there is something that the average person in the street can do about this. It's around responsible meat consumption. If we desire to have large volumes of inexpensive meat on a daily basis, then we will be fueling antimicrobial resistance because we will be incentivizing intensive farming to grow and to use antibiotics routinely. If we choose to go back to probably where we were a few decades ago and see meat as a luxury to consume once or twice a week, source it responsibly from good organic providers, then we can directly impact on the growth of antimicrobial resistance.
Yeah, I think that is a huge issue, isn't it? I mean, food production, ethical food production, and where that because a lot of people, when I speak to them about antimicrobial resistance, they say, "Well, I've heard of that in food," but they don't link it to, I could actually get that when I'm a patient. So I'm really glad that you brought up both of those things because I think as advocates, I personally as an advocate, I advocate for both. Because it doesn't just matter what happens to me in a hospital setting, but it also matters to me the type of food that I eat, and and the way that I advocate for producers and resellers and so on in terms of being responsible for the way that they are using antibiotics in their products. So I think to end, have you got a closing remark which you think patients and members of the public could benefit from hearing in terms of tackling AMR for sepsis?
Absolutely. So to sum this up, antimicrobial resistance and sepsis are intrinsically interrelated. They are part of the same problem, which is a threat in the near future of infections we simply can't treat. AMR is here today. We need to stop talking about AMR as a perceived future threat where we might not be able to have a hip replacement in a few decades' time. It's here now. It might affect someone you love tomorrow. We need to give AMR a face, as you and the AMR narrative are doing brilliantly, Vanessa, and make it immediate and personal to our public, because that is the reality.
Great. Thank you very, very much for your time, Ron. And yeah, I mean, we look really forward to working with you and learning more about sepsis and learning more about, how patients should be more aware of the impact of AMR and sepsis. And yeah, we'll see you soon again. Thank you.
Perfect. Thank you so much.
So thank you so much for watching our video today. To learn about our guest, the UK Sepsis Trust, and our work as a charity as the AMR Narrative, you can find out more details in the description below. And remember to like and share this video, as well as leave your comments and subscribe to our channel. Thank you so much. We'll see you again next time.